With the recent developments occurring throughout the world in response to the coronavirus pandemic, many aspects of our medical system have come under intense scrutiny. The high cost of healthcare, the systemic prioritization of certain groups and races, the status of health as a right. The list just goes on and on and on. However, one aspect that hasn't really been touched on is perhaps the most deadly. Today, I am here to discuss with you an aspect of our healthcare system that I believe desperately needs reform: drug regulations. In such a developed country as ours, why should 1 month's supply of Truvada cost $6 to produce, but $1,600 to buy? Although it's easy to just brush off this problem as irrelevant due to sufferers being a minority, inflated prices are not unique to these specific medications. In fact, the abnormally high prices of medication in the US provide enough justification to begin comprehensive drug regulations, as seen through the failures of our system and the successes of others. According to the World Health Organization, one's health, or lack thereof, should not expose the user to financial hardship. To amplify this detail, let us examine the procedures that must be completed before a new drug can be approved in Australia. If you were to try to enter the Australian drug market, your first order of business is to submit an application to the Pharmaceutical Benefits Advisory Committee, where you have to prove why your drug deserves to be on the market and how it's more effective than other medications. The committee will then collaborate with the country's national health system to decide whether or not to buy your drug and at what price. If you're approved, it's up to you to then decide whether or not the price the committee has offered you is sufficient. If so, congratulations, you have just entered the Australian drug market. Due to tough regulations such as these, a Humira prescription in Switzerland costs around $822. Compare that to the $2,669 it costs in the United States. Opponents to the system often emphasize that drug manufacturers have made an investment and they deserve a return on their investment. The effect of this rhetoric is a period of exclusivity during which manufacturers are able to exercise monopoly power pricing. Although, of course, we must be grateful for them and for their creation of so many life-saving medications, we are not required to appease their greed. Their greed is detrimental to society. Children are dying of treatable ailments. People avoid going to the doctor because they know that they won't be able to pay for their medication. In some cases, people even have to rely on the generosity of those on the internet through websites such as GoFundMe in order to live. All of these are a result of pharmaceutical companies' greed. In the US today, cancer drugs are commonly priced at around $100,000 a year, which is a stark contrast to the median average household salary of $62,175 as of June 2018. This is causing hundreds of thousands of cancer patients to delay care, cutting their pills in half, or just foregoing treatment altogether, a Kaiser Health News examination showed. What kind of society are we if we are forcing our sick who are desperately in need for help to ration their life-saving medication to avoid bankruptcy? This effect is made even worse by a common practice between manufacturers of a brand-name drug and generic products. As explained by former Congressman Henry Waxman, a manufacturer of a brand-name drug can go to a generic manufacturer who's ready to go into competition and pay that manufacturer not to go into competition. They both come out with more money, but that means that the consumer and the insurance companies have to pay a higher price because of the lack of competition. This immoral action perfectly showcases pharmaceutical companies' obsession with money, despite their claim of solely operating for the benefit of the customer. Why else would they choose money over affordable drug prices? In the future, drug costs are expected to exceed those of all other healthcare services, such as doctor's visits and hospital care. It's about time for us to begin thinking about the future of this country and to take proper steps in the right direction. It may seem easy to rank societies by using quantitative measures, such as education, or wealth, or GDP, but the true measure of a society is based on how it treats its people, because after all, a society can't prosper if all of its members are sick.